During Mental Health Awareness Month, we're highlighting one of the most common complications in pregnancy and childbirth, maternal mental health conditions. So joining us right now is mental health counselor Kate Ramsey. Kate, thanks so much for being with us this morning.
Good morning. Thank you so much for having me.
Now, 1 in 5 childbearing women will experience a mental health disorder during pregnancy or postpartum. 75% of these women do not get proper recovery care. Why is that, and what can we be doing to change that?
So I think there's a number of factors here. I think a big factor is just silence around it. So bringing attention to it with mental health awareness months like this are really important. I think many women that I've spoken with feel that they should be ashamed of it, that they need to keep quiet, that there's something wrong with them. And I think that statistic that you quoted early on, that 1 out of 5 women will experience this, really shows that this is a problem for women in all walks of life, and their supports, whether it's their partners, their families, pediatricians. We should be asking the women in our lives who have just given birth, are you okay? What do you need? How can I help? So I think we start there in the community and build support for women who are struggling.
Now, over the last few years, a lot of celebrity women have come out and said that they struggled with this. Big names like Adele, Drew Barrymore, Gwyneth Paltrow, Angelina Jolie. They've all said that they've struggled at some point with postpartum depression. And that, I think, really goes to show all the women out there that this can happen to anybody across all walks of life.
Absolutely, and I think that points to the fact that it really is an internal mental health issue. It's not about how much money you have, what kind of supports, because certainly you're looking at people who have a whole team around them, but the fact that nothing can prevent this because it is a mental health disorder. However, we do see that it disproportionately impacts people of color and people in poverty because they do not have the resources to assist them in recovering. And again, the shame and guilt aspect is enormous.
Now, because we, as women, as moms, we always feel the need to be okay, to take care of everything, that we are last on the list. So what should other people be looking out for when that mom that you know that you love says, I'm fine, I'm just tired? What are the warning signs that we should be looking out for to say, but are you really?
Yeah, one of the big ones, and this is a hard one to see for a mental health issue, but one of the big ones is lack of sleep. So many new mothers do not get the sleep they need to begin with, but then postpartum depression can actually make it even harder to sleep when they have that opportunity. I think any signs of depression, irritability, eating too much, eating too little compared to what a person normally consumes, these are the kinds of signs and symptoms. And of course, so much of the time when we're brand new with a brand new baby, we are exhausted and we are irritable. But does it extend out longer than a couple weeks? You know, you really want to be aware and continue the conversation. You know, we have a saying in my house, do you need support? Do you need solutions, or do you need space? So people who are surrounding the new mother, ask that question. What do you need right now? Do you need to get out of the house and get away from everything? Do you need to talk, or do you need me to just be with you and have a cup of coffee?
Those are really important questions to ask. Kate Ramsey, thanks so much for being with us. We do appreciate it. And of course, anyone watching, if you are struggling, please don't be afraid to reach out and ask for help. That is the first step.